Hello everyone, this is Dr. Sukandas for you once again. As you all know, I am a consultant in nephrology and kidney transplantation practicing in Bhubaneswar, Odisha. Today I'll be talking about kidney transplantation and most importantly, what are the specific care a patient of kidney transplantation should take after the transplantation of a kidney. As I have often told, kidney transplantation is the best treatment available for a patient of end stage kidney disease. When a patient reaches end stage kidney disease and he or she is on dialysis, for those patients the best treatment available is kidney transplantation because kidney transplantation promises a near normal life for the patient. And whenever someone asks me, I just tell them, and it has been proven all over the world that kidney transplantation allows a patient to lead a near normal life. They can get back to their professional life, their marital life, their social life, their financial life. Every aspect of life is improved after kidney transplantation. So even the longevity of life is significantly improved. In a patient of dialysis, the significant mortality rate for first 5 years is a very debilitating factor. But after transplantation, we can expect a patient to live long. They can live long, more than 10 years. Sometimes patients have lived longer than 20 years or 30 years. And for all that, it is important for us to ensure the post transplantation care. So, what are the possible areas where one needs to look into? One of the first things I would actually discuss under three basic important points. First is all graft dysfunction, second is infections, and third is what are the metabolic complications. For common patients, if I say graft dysfunction, what is graft dysfunction? Kidney that is transplanted into a patient is known as a kidney allograft. To keep the kidney safe, the transplanted kidney safe, we do a lot of important things. The most important thing that we do is we give immunosuppressive medications because every human being tries to reject a foreign body, and a transplanted organ is like a foreign body, and the recipient tries to reject it. That is why he or she is being given immunosuppressive medications. So these immunosuppressive medications are to be taken very, very regularly in time. Especially the first 3 months after transplantation are very, very important. And what are these immunosuppressive medications? These immunosuppressive medications primarily are three important categories of medications. First one is CNI inhibitors. This can be either cyclosporin or tacrolimus. Long back, cyclosporin was used at least for last 10 to 12 years. Most commonly, tacrolimus is used. Tacrolimus is an important drug and it keeps the kidneys safe after transplantation, but it is important to remember that tacrolimus has got a very narrow therapeutic index. In other words, its label has to be maintained so that it is under its safe limits, because if its label is high, then it can cause certain side effects for the patient. And the label in first 3 months is usually 8 to 12, and from 3 to 6 months the label has to be 6 to 8, and after 6 months the label is around 4 to 6. It should be around 5 after 6 months. It is important the patient should remain under regular follow-up his or her nephrologist for a regular maintenance of the tacrolimus label. The second important drug is the MMF or mycophenolate mofetil, and its other alternative is azathioprine. Azathioprine was earlier used, but nowadays mycophenolate mofetil is regularly used, and the dosages of the drug, of course, are either 2 tablets in the morning or 2 tablets in the evening or 3 tablets in a day. It depends from person to person and different points of time after transplantation of the patient. The third important thing and the very commonly used drug in a kidney transplantation are the steroids. Normally we use prednisolone, and prednisolone has been a mainstay of patients of kidney transplantation for last many years. In fact, it is one of the most commonly used drug even for last 30 to 40 years. This is a drug even before the introduction of newer medicines. Prednisolone has been a mainstay of kidney transplantation immunosuppressive regimen. Today or nowadays, the plan is to reduce the dose of steroids. Sometimes patients take as less as 5 milligram daily dose of steroids, but it is important that is also an important aspect of the or a mainstay of the treatment in post-transplantation patients, and this medication has also been taken regularly, and patients should not miss all three important immunosuppressive medications are to be taken. The second thing is the important that the patient should be under regular checkup. As a patient of kidney disease, we know that most of the kidney disease early stages are asymptomatic. The same thing happens after transplantation also. So if a patient is not under regular checkup, he or she will fail to understand if the graft function or the kidney function is doing well or not. That is why they have to get their urea creatinine levels and other parameters regularly managed, and under the follow up their nephrologist, because the slightest change in creatinine level we can detect early. If there is a rise, there could be possibility of resection, there could be possibility of other causes of graft dysfunction that can be promptly diagnosed and managed. The other important aspect after kidney transplantation is infection. As I have told, it is an immunosuppressive medication. There are three immunosuppressive medications, or patient is on immunosuppressive regimen. This regimen is given because we have to ensure that the patient does not get into a resection after transplantation. So a fine balance has to be maintained. However, it also reduces the patient's immunity, and so, infection is a very important aspect after transplantation. One has to be watchful, and one has to, these days, after the COVID pandemic, most people are used to wearing masks. So, patients of transplantation should no longer feel any kind of hesitation or embarrassment in wearing a mask in public places. They should try avoiding close contact with people who have got common cold or respiratory infection or any overt skin infection. They should eat clean or safe drinking water, avoid eating outside, avoid eating contaminated food, and have to have go for regular hand washing, so that incidence of all this infection, whether it's respiratory infection or gastrointestinal infection, all these things can be prevented. And of course, the third important thing, as I was telling, is metabolic aspects. What is metabolic aspect? In this aspect, I will tell most importantly diabetes. Now, diabetes is, we all know, is the most important cause causing chronic kidney disease or end stage kidney disease, and patients requiring kidney transplantation. The most important cause for kidney failure in India, all over the world, is diabetes. But it has to be remembered that even after kidney transplantation, patients continue to have diabetes, and more importantly, because the patient is taking steroids, because the patient is taking medications like tacrolimus, patients' dietary habits improve, their eating habits improve, so blood sugar can be more deranged. So blood sugar monitoring has to be intense, either under the follow-up their nephrologist, or under certain circumstances, if required, they should take the consultation from a diabetes specialist and make sure that their blood sugars are under control limits. Another important thing is that some patients, around 10% of patients, can develop diabetes after transplantation, where we call it as new onset diabetes after transplantation. So that is also another aspect which has to be looked into, and that needs to be monitored. So as a whole, what is important, if I can summarize, patients should be under regular follow-up. Patients should take their immunosuppressive medications regularly with a regular drug monitoring, should be mindful of infections and infective complications, and should be mindful of diabetes and other metabolic complications. Along with, of course, they have to continue with their medications for their blood pressure, and maintain a healthy regular lifestyle, avoid smoking, avoid alcohol. So all these things, if are properly followed, then a transplantation patient with this appropriate post transplantation care can expect to live a long life, healthy life, and as normal life as possible. So that is what I would like to tell all my personal patients, and with all these guidelines, I definitely believe they can lead a very good life. So wishing them very good luck. This much for today. We'll come back again. Thank you.